What's up, Josh? So for the first test we're going to do today, we're going to do the row test. And the row test is pretty much a fulcrum test with horizontal abduction. So go ahead and lay on the table, put your head over here. On your back. So this row test, what we're looking for here is we are looking to test for glenohumeral instability and generally just labral tears. So fulcrum test is I would bring her up to an external rotating position. I would put my hand under her shoulder. What I would typically do is that for a fulcrum test. But for this, pushing down the elbow, horizontal adduction or abduction. And a positive test for this is going to be pain with apprehension because they don't want the glenohumeral, the ball and socket joint to go forward. So that's the row test. So again, what we're looking for is glenohumeral instability and potential labral tears. So second test we're looking to do is the jerk test. And the jerk test is for posterior instability. So usually we wanted to have the patient supine for this because usually, or at least the way the image had it, was having them sitting, like short sitting, straight up and down. So the jerk test, you're up here and you literally have a good stopping point there. So what we're looking for there is posterior instability. We'd see like a clunk, or how did I word it? Yeah, so it's like a sudden jerk backwards or a clunk. This is when you do bilaterally. You do all of them bilaterally. So next up, we're going to have Fegan's test. So go ahead and sit. Well, let me see real fast if there's any other ones that. Yeah, the rest of them are sitting. So close to the edge of the table. Okay. No, this way. All right. So this is another one where we're looking for inferior laxity. So what you would do, abduct them to 90 degrees, weave your hands up like this, you push down right on that AC joint area. And since there's no significant laxity, that's a negative test. We're also looking for apprehension. So anterior and inferior laxity, that's what we're looking for. All right. So next up we have, I'll do the bicep tension test first. So bicep tension test, what we're looking for here is a slap tear. So that's a labral tear, superior labrum, anterior to posterior. What I'm going to do is I'm going to bring you up and externally rotate your arm. And then what I'm going to do now is I'm going to stabilize up here and I'm going to push down and I'm going to have you resist me, okay? Mm-hmm. Let it go down, but just resist me all the way down, okay? So bring it up to 90, externally rotated. Okay. So we're looking for a slap tear there. A positive sign for that is going to be pain like in the shoulder. So it's going to feel like it's inside the shoulder, right? Next up, we have the AC shear test. So AC shear, I need to have you positioned in a certain kind of way. Doesn't seem that way. So what we're looking for here is an AC joint sprain. Weave my hands. So, sorry about that. The chromium process right here, okay? So weave hands and compress. Now, a positive sign for this is going to be discomfort and AC joint movement. So we're looking for this AC joint to come down or move in any excess way, really. After that, we're going to do the AC crossover. So this is a passive movement. That's important. And what we're looking to do is we're going to passively flex the patient's arm and horizontally adduct them. Right? Now, we're looking for here this is going to be the pain and discomfort over that AC joint right here. So passively, you just bring them up into flexion, and then you bring them over. Big old arms. What else did I want to do? I wanted to do the anterior slide. Anterior slide. Oh, wait, you are short sitting. Nice. So for this, patient post up on the hip, and then hold a hand on the shoulder. You're pushing the elbow anteriorly. You are not moving at all. My goodness. For the anterior slide, what we're looking for is another slap tear, again, superior labrum, anterior to posterior. And we are going to be seeing pain in the antero-superior aspect of the shoulder, right up in here, maybe with some popping or some cracking. So, any pain there?
No.
No. Let's just try this side too. Nope. Okay. Go ahead and stand up for me. Now, this isn't for any credit, what I'm about to do, but just for the hell of it. So Josh, we talked multiple times in class about how Ava, in particular, might be a good candidate for impingement testing. So come on over here. Good.
Oh, goodness.
All right, so we're going to do here, we're going to do the near impingement test. So go ahead and hands in like that. Bring them up to your ear. Any pain with that?
No.
No? No pain? All right. Hand over here. Push it up. Any pain?
No.
Try with that arm.
No.
That's called a Yokel's test. Let's see what else we got here for impingement. We have a posterior impingement test on that one. If you get that up on the table. Hawkins Kennedy. Okay. So 90 degrees of flexion, 30 degrees of internal rotation, horizontal adduction. So 90 degrees of flexion. So bring it up like that, bring it across. Any pain there?
Mm-mm.
Doesn't seem like our girl here has impingement.
You're good.
Good work.
Good to go.
And that is all for me today.